As couples age, reaching 50 years and beyond, many aspects of life begin to shift: physical health, emotional dynamics, social interactions, and yes, even sexual relationships. While aging can bring changes to sexual function and desire, it by no means signals the end of intimacy or the joy that comes from sharing closeness with one's partner. In fact, maintaining a healthy sexual relationship in later years offers multiple benefits that are both medically and psychologically significant. From a medical standpoint, sexual activity can serve as a gentle form of exercise, promoting cardiovascular health by increasing heart rate and improving blood flow. This, in turn, helps reduce risks associated with heart disease, which is a leading health concern for individuals over 50. The physiological act of sex stimulates the release of important hormones such as oxytocin, dopamine, and endorphins, which elevate mood, reduce stress, and foster feelings of happiness and bonding. Oxytocin, sometimes called the love hormone, plays a particularly vital role in enhancing emotional attachment between partners, reinforcing intimacy and trust that often grow deeper with age. These hormonal benefits can also help counteract feelings of loneliness, anxiety, and depression, conditions that tend to increase in prevalence among older adults due to factors such as retirement, loss of loved ones, or chronic illness. However, aging bodies may face certain challenges that require thoughtful adjustments to sexual practices. For instance, many elderly individuals experience changes such as reduced testosterone or estrogen levels, which can affect libido and physical comfort during intercourse. Women might encounter vaginal dryness or thinning of teeth, making penetration uncomfortable or painful if not properly managed. Men might face erectile dysfunction or slower arousal. It is crucial for couples to communicate openly about these changes, exploring alternatives such as using lubricant, taking more time for foreplay, or experimenting with different positions that reduce strain and enhance comfort. Furthermore, pre-existing medical conditions common in older adults such as hypertension, diabetes, arthritis, or heart disease can impact sexual function and safety. Individuals with cardiovascular issues should discuss with their healthcare providers the appropriate frequency and intensity of sexual activity, as it is a moderate physical exertion that might require monitoring. Medications taken for chronic illnesses can also affect sexual desire or performance, making medical consultation an important part of sustaining a fulfilling sex life. Emotional intimacy is equally important in older couples, and sexual activity plays a profound role in strengthening the emotional bond between partners. Touch, closeness, and mutual pleasure communicate love and reassurance beyond words, which is essential for psychological well-being in later years. Many couples report that the quality of their sexual experiences improves with age, as they become more attuned to each other's needs and desires, allowing them to cultivate deeper connection and trust. Intimacy in this stage of life can take many forms, not just intercourse, but also kissing, gentle massages, and other affectionate gestures that convey warmth and care. These actions release oxytocin and reduce cortisol, the stress hormone, contributing to a sense of safety and belonging. In addition to emotional benefits, maintaining an active sexual life can have practical health advantages. Regular sexual activity has been linked to better immune function, improved sleep quality, and even pain relief due to the release of endorphins, which act as natural analgesics. For women, sexual stimulation can promote pelvic floor muscle tone, helping to prevent issues like For men, it may support testosterone levels and prostate health. Importantly, the mental stimulation and novelty that come with sexual intimacy can help keep cognitive functions sharp by encouraging brain activity related to pleasure and reward circuits. While sexual activity in older adults offers many benefits, it is essential to approach it with safety and mutual respect. Age-related changes in stamina mean that frequency might decrease compared to younger years, and that's normal. Experts generally suggest that there is no set ideal frequency for sex. Instead, it should be based on the couple's comfort, desire, and health status. Some couples may be sexually active multiple times a week, while others may prefer once a month or less, and both are perfectly valid. Listening to one's body and maintaining open communication is key to ensuring that intimacy remains a positive and fulfilling part of life. Another critical aspect for elderly couples is the prevention of sexually transmitted infections. Although often overlooked in older populations, STIs can pose serious health risks, especially if undiagnosed or untreated. Safe sex practices, including the use of condoms when appropriate, regular health checkups, and honest discussions about sexual history remain important at any age. Psychological barriers can also affect sexual activity in older couples. Fears related to performance, body image concerns, or societal taboos about elderly sexuality can create stress or reduce libido. Counseling or therapy, either individually or as a couple, can be beneficial in addressing these issues, fostering self-confidence and helping partners reconnect emotionally and physically. In conclusion, sexual intimacy for couples aged 50 and above remains a valuable component of health and happiness. It promotes cardiovascular health, emotional bonding, hormone balance, and mental well-being, while also providing physical benefits such as muscle tone and immune support. Adjustments based on health conditions, physical comfort, and mutual consent are necessary to ensure safe and satisfying experiences. With open communication, medical guidance, and a focus on emotional connection, elderly couples can enjoy a fulfilling sexual relationship that enhances their quality of life and nurture their love for each other well into their later years.